Anxiety is a common symptom that occurs in all psychiatric disorders, including depressive illness and most psychosis. Physical diseases like hyperthyroidism, cardiac disease, or hypertension may also present with anxiety and therefore must be excluded. There are various forms of anxiety disorders. For example, generalized anxiety disorders, panic disorders, phobias, obsessive compulsive disorder, acute stress disorder, post traumatic stress disorder, among others. The common ones seen in general practice are generalized anxiety disorders and panic disorders. In all cases of suspected anxiety disorders, it is important to assess the scope of the anxiety, including the antecedents, behavior, and consequences of anxiety for the patient through an in-depth interview. It's also important to ask about the presence of obsessive thoughts and compulsions, as these are increasingly common and tend to be reported out of embarrassment, but which lead to much personal distress. In this case, refer to a psychiatrist. In generalized anxiety disorders, there is excessive anxiety and worrying about events or activities such as performance at school or work, occurring on most days for at least 6 months. A panic disorder refers to a pattern of recurrent, unexpected attacks of intense fear or discomfort over a discrete period more than 3 times a week. During attacks, four or more of the symptoms I'll mention develop abruptly and reach a peak within 10 minutes. Panic disorders are accompanied by persistent concern about having another attack or worrying about implications of having an attack. In children, especially, partial complex seizures may mimic panic attacks as in children. Medications are required to treat panic disorders only if the attacks occur frequently enough to cause distress. Panic disorders, the causes are largely unknown, but misinterpretation of normal internal body stimuli, for example, a quickened heartbeat interpreted as a heart attack or serious illness, could be present. Also, misinterpretation of external stimuli, like crowds and closed spaces such as moving vehicles, lifts, etc., as signaling danger. Also, contributing factors are stress and genetic predisposition. The symptoms are fear of dying or going crazy, palpitations, pounding heart or rapid heart rates, trembling or shaking, sensation of shortness of breath, feeling of choking, chest pain or discomfort, feeling dizzy, unsteady or faint, numbness or tingling sensation, chills or hot flashes, derealization as feeling of unreality or depersonalization, feeling of detached from oneself, and also nausea and abdominal distress. The signs that are usually listed are tachycardia, tremors, and sweating. Investigations, non-diagnostic. The main treatment objectives are to stop the attacks of panic, or at least reduce the frequency and intensity of symptoms to a minimum, and to help return to normal activities of daily living to prevent recurrence of symptoms. Non-pharmacological treatment: breathing in and out of a paper bag close around the lips and nose, and avoid polythene bags. Try large paper envelopes. Eliminate caffeine containing foods like tea, cola, coffee, chocolates from their diets as they tend to worsen anxiety. Relaxation training, and also cognitive behavior therapy. Pharmacological treatment. Initial management for patients unresponsive to non-pharmacological treatment. The first line treatment, you give fluoxetine oral in adults 10 milligrams daily as a single morning dose, and then increase up to 60 milligrams daily if necessary in children 6 to 18 years if 10 milligrams daily, and then increase up to 20 milligrams daily after 1 to 2 weeks if necessary. Or you can give sertraline oral in adults 25 milligrams daily as a single evening dose, then increase to 50 milligrams after 1 week if necessary, and then 50 milligrams weekly to a maximum of 200 milligrams daily if necessary. Children is not recommended. Or you can give imipramine oral in adults 25 to 50 milligrams daily as a single evening dose with a maximum of 150 milligrams daily. Children is not recommended for this indication. For very frequent panic attacks, you give lorazepam oral in adults 1 to 4 milligrams daily for 2 weeks. In children 2 to 18 years, you give 0.05 milligrams per kilogram daily for 2 weeks. For anticipated anxiety attacks, you give lorazepam oral in adults 1 to 4 milligrams that, in children 0.25 to 0.5 milligrams that. And for acute symptomatic control, you give lorazepam oral in adults 1 to 4 milligrams 8 to 12 hourly as required with a maximum of 10 milligrams daily. In children, is not recommended for this indication. Or you can give alprazolam oral in adults 0.25 to 0.5 milligrams 6 to 8 hourly, and increase if necessary every 3 to 4 days, the maximum of 4 milligrams daily. In children less than 18 years, is not recommended. Or you can give diazepam oral in adults 2 to 5 milligrams 12 hourly for 2 weeks and gradually taper off over the next 2 weeks. And do not give for more than 1 month continuously. In children 1 to 12 years, you give 1.25 to 5 milligrams 6 hourly as needed. Duration of treatment for recurrent cases should be at least 6 weeks and should be continued for up to 6 months or more after attacks have remitted to prevent early relapse and wean off slowly over a month or more. Referral criteria: refer children with symptoms suggestive of a panic disorder to a pediatrician. Also refer patients to a psychologist for cognitive behavior therapy and to a psychiatrist for additional drug therapy where indicated.